Mr. President, we are working at HHS to advance your agenda to make America healthy again. I'm working with Lee Zeldin to reassess the fluoride rules based upon the August release by the National Toxicity Program of new science that shows a direct inverse correlation between exposure to fluoride and IQ loss, particularly in children. Lee and I were in Utah this week, to announce that Utah became the first state in the country to ban supplemental fluoride. I'm working with Brooke on, and governors now in 24 states who are advancing MAHA legislation to get soda pops off of the food stamp program, off the SNAP program. We've launched Operation Stork Speed to get the bad chemicals out of baby formula. We're working with governors across the country to get good food into the school lunch programs and to get rid of food chemical dyes and other bad chemicals that are in our food. We've shown now that this directly affects academic performance, violence in the schools, and mental health, as well as physical health. We are working with governors across the country to get cell-to-cell or bell-to-bell legislation to restrict the use of cell phones in schools, which again dramatically impacts academic performance. Today we announced a dramatic reduction in animal testing at NIH and FDA. We're going to switch over to AI, which we've now found is much more precise in identifying the impacts of toxics in various products. We're working with Elon, who's done an incredible job to eliminate the redundancies and to streamline operations at all the health agencies and to recalibrate our trajectory to your agenda of making America healthy again. And finally, the CDC has done an amazing job at getting the measles outbreak under control. We have about 680 cases now in 22 states, compared to the same outbreak in Europe, which is 127,000 cases and 37 deaths. Our numbers in this country have now plateaued. And I want to thank CDC for that. And we're trying to refocus the press. We've had 3 measles deaths in this country over 20 years. And we're trying to refocus the press to get them to pay attention to the chronic disease epidemic as you've asked us to. We have now 38% of American youth are pre-diabetic. This was unknown 30 years ago. Every child that becomes diabetic, there should be a headline about them. We have 100 million adults who are pre-diabetic or diabetic. And we have, we have now the autism rates have gone from now most recent numbers we think are going to be about 1 in 31, 1 in 20, so they're going up again from 1 in 10,000 when I was a kid. And we are going at your direction. We are going to know by September. We've launched a massive testing and research effort that's going to involve hundreds of scientists from around the world. By September, we will know what has caused the autism epidemic, and we'll be able to eliminate those exposures.
So big. Think of that. So it was 1 in 10,000 children had autism, and now it's 1 in 31. Not 31,000, 31. That's a horrible statistic, isn't it? And there's got to be something artificial out there that's doing this. So you think you're going to have a pretty good idea, huh?
We will know by September.
There will be no bigger news conference than that. So that's it. If you can come up with that answer where you stop taking something, you stop eating something, or maybe it's a shot, but something's causing it. It can't be from 10,000 to. Can you imagine that, Marco? That's a big number. Thank you very much. You're doing great. Thank you, Bobby.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.